Apologize for that. And I was a little upset because I knew the number and the information that was being provided by the controller was false. And I just want to lay this on the table now. Dr. Burstein was not the highest paid employee by overtime in 2020 and 2021 combined. She was not. There was actually an employee in the sheriff's office who made more in overtime combined in 2020 and 2021 than Dr. Burstein did. The numbers that the controller provided were wrong. They were wildly wrong. And I want people to know this. Erie County is a very large organization that through the last 2 years has responded to a global pandemic as the chief responding entity on behalf of the people of Erie County. We're a $1.5 billion entity. That's billion, not million. It is not surprising for Erie County employees to accrue overtime because they have the right to accrue overtime, as all employees except for the elected officials are technically paid on an hourly rate. In fact, combined for 2020 and 2021, Erie County paid out more than $46 million in overtime across all the divisions, which includes the sheriff's office, it includes the departments that I oversee, including the Department of Health. It includes everything. And all of our employees are eligible for overtime except those that work as elected officials. They are not, because those are the only true salaried employees. And I'll be glad to get into this in further detail later. But when we talk about overtime, Dr. Burstein didn't even receive the most overtime that was paid by Erie County over the last 2 years. That was an employee in the sheriff's office. And when it comes to overtime, the sheriff's office employees are generally the ones that get the vast majority of overtime. So I'll go into that in a little greater detail afterwards, but I wanted to put that out there. First off, I want to apologize to the people of Erie County for using a swear word last week because I was hot. I try to keep cool in situations at all time, and I knew the information that was provided by the former controller was wrong. It was wrong. His numbers are wrong, and I'll go into a little greater detail on that later. But I did want to apologize, and I want the public to understand that the people of Erie County and our citizens of Erie County, that the people of Erie County government work hard and have worked very hard on behalf of you these past 2 years. And Dr. Burstein is the only doctor outside of the medical examiner's office, is the only doctor that we have during a global pandemic. And she has hundreds and hundreds of responsibilities beyond what we normally would deal with in a global pandemic. Everything from lead prevention to issues associated with cancer screenings, STDs, you name it. And she's worked very hard. I know she's worked very hard because I'm the one, like others, who receives emails from her at 1, 2 o'clock in the morning with the latest information that we often don't get until late in the evening. So I want folks to understand that she has earned every penny, and she's entitled to every penny, as just are all the other employees, including the other ones, including a gentleman who made actually more money in overtime than she made over the last 2 years. The summary for January 2nd, we had 1,541 new cases on January 2nd. We are still waiting for confirmation of yesterday's, January 3rd's data. Hopefully we'll have that later in the afternoon. January 3rd. The positivity rate for January 2nd was 21.8%. That seems to be standard as to what we're seeing in New York State. I've been seeing positivity rates in other parts of the country that are coming in at 33 to 40%. So we got COVID everywhere in the country. We had 14,347 new cases in the last 7 days alone. That's approximately 1.5% of all county residents catching a new case of COVID. To give you an idea of how many cases of COVID have occurred in the last 7 days compared to earlier parts of the pandemic, we've included today the breakdown of COVID-19 cases since the beginning of the pandemic, March of 2020, all the way to the most recent date that we have data of January 2nd. The white boxes that you see on the screen are equivalent to 12,000 combined cases. From March of 2020 through October, we had a little more than 12,000 cases. So when everything was shut down, we had 12,000 combined cases throughout all of Erie County. And then you see the bump that occurred last winter, 12,000 cases in roughly 6 to 8 weeks. And we had 12,000 cases or so in the in the spring of 2021. And then you see that very high bar at the end. That's 7 days or so, 6 days of data, the last 6 or 7 days for 12,000 cases. That is how fast it has grown exponentially. It is ridiculous how many people are catching COVID right now. So I want people to understand that this is a huge problem, of course, nationwide. But when you made a comparison of the last 12,000 cases and compared it to other parts of the pandemic where we had 12,000 cases, there is no comparison. What we are dealing with now is the worst when it pertains to the number of individuals who are catching COVID. And we'll go into a little greater detail about that fact as well as what we're seeing as a result of all these new cases. So cases increased by 160% from the previous week to 13,460 as of this past Saturday. We had record total tests reported. We had a lot of people saying they couldn't get tests, but we actually had the most tests that were ever reported in a week. 67,200 or so were performed in Erie County from Sunday through this past Saturday. 20 to 39-year-olds are driving the surge. The age group accounted for 43% of all cases. And the 30 to 39-year-old age group had the highest 7-day case rate per 100,000 persons, basically 2,700 out of 100,000 persons, or 2.7%. Very high. And the weekly positivity rate increased to 20%, up from 10% the previous week. It's just very, very high everywhere. Now you see a breakdown based on the zip code. The numbers are extremely high all over the place. The city of Buffalo, though, has definitely seen a tremendous spread. Not totally surprising due to the density of the city of Buffalo. This is kind of what we expected during the Delta surge, but we didn't see it because it was spread all over. But the city of Buffalo has high numbers. The suburbs have high numbers. And yes, some of our rural areas have high numbers too. But where there's a lot of people who live in an area, the rates are much higher because the transmission rates are just ridiculous, is the only way to put it. Hospitalizations, this is key. This is key pretty much to everything we are watching and doing right now, is will the hospitals get to a point where they are so saturated with patients they can no longer take more patients. This is why I implemented the mask mandate. It's why Governor Hochul implemented a mask mandate statewide. So COVID-19 patients have increased by about 50% in the last 10 days. We saw the drop right around Christmas. We were doing so well as a community. We were continuing to go down while other areas were going up, and then, of course, we continue to go up. There were 378 patients that were COVID-19 positive in the hospital on January 2nd. The hospital capacity has been rising. It was in the low to mid-70s. It's now 86% of all beds are full, 78.5% of ICU beds. That is concerning. The one thing we are really kind of happy to see, we don't know if it'll continue, but we are at least pleased to see, is ICU numbers have not been rising at the same percentage as overall hospitalizations. Hospitalizations have been going up. It is a big concern. We don't want our hospitals to be without beds, and we know that there are still some hospitals in Erie County that have no room for another patient. But the ICU numbers have not gone up at the same rate as the others, though we have had quite a number of deaths lately. You see that bottom line, 4 deaths on January 2nd, 2 on January 1st, 4 on the 31st, 1 on the 30th, 6 on the 29th, 12 on the 28th. These are all people who died in Erie County hospitals. And we offer our deepest condolences to each and every one of the individuals out there who lost a loved one due to COVID. There's 474 COVID-19 patients in total in all Western New York hospitals, and those numbers continue to grow, as we'll show in a moment. Here's the bar for the hospitalization in Erie County. You saw that nice drop we were seeing. We had the big Delta increase. We implemented the mask mandate, seemed to be making a difference. Hospitalizations are going down, and then Omicron hit, and all bets are off at this point. The hospitalization data for the Western New York region, same thing, nice little drop. Now we're starting to see an increase once again. Vaccinations through January 3rd, we have high rates with at least one dose, but remember, you got to have the full regimen of 2 doses, Pfizer, Moderna, and if it's been more than 6 months since you got your Pfizer, Moderna second dose, you got to get a booster. Good news is 404,823 booster doses have been administered in Western New York. It's good news. But we know there's more than 1 million people that live in Western New York. So we got to get that number up. Erie County responds. We are giving out masks. I was out on New Year's Eve with others giving out masks from the county. We're distributing the nonprofit agencies, houses of worship, KN95 masks. Not-for-profits and houses of worship can request them through Western New York's 211. Food pantries, you can request them through Feed More Western New York. Town and village and city emergency managers have already received masks for public distribution, and we'll be receiving more. The county's own stockpile, distributing them out there. Erie 1, Erie 2 BOCES, and Buffalo Public Schools have received masks for staff and students, and we distributed a significant portion of our KN95s to Erie 1, Erie 2 BOCES, and Buffalo Public Schools so that they would have an adequate supply of masks as we deal with this Omicron surge. Individuals and households, Erie County is distributing KN95 masks as well as procedural masks through various sources, not-for-profit agencies, but also the Buffalo and Erie County libraries. I want to thank the members of the library board and the librarians for distributing masks so we can get them out to all parts of Erie County. We all know where our local library is. We all enjoy our local library. If you need masks, we have distributed them to the library. Some of the libraries are already out. You should call the library before you go down to see if they're out. We will be distributing more masks in the future to the libraries. We're also going to do drive-through pickups for masks, as well as at-home COVID-19 tests. Those are going to be scheduled and will depend on delivery as well as winter weather. We all know we're expecting a storm Wednesday and Thursday, so we're probably not going to be doing any drive-through pickups on Thursday. But as we get these additional supplies, we'll be doing more of these in the future. Now I want to turn it over to Dr. Burstein to talk about proper mask etiquette and wearing.
Thank you, and good afternoon. So I just want to talk just a little bit about some basic tenets with mask wearing, because mask wearing is so essential to prevent COVID-19 transmission, especially with the Omicron now. So as you remember last week, I reminded people that the best mask is a mask that has highest quality that you can find, that fits well against your face, so tight against your face so you don't have any gaps between your cheek and the mask, and that it's comfortable, and it's something you feel that you can wear for a prolonged period of time, hours. And so there are several different flavors of masks. So last week I brought my my N95, and we have N95s, as a county executive I mentioned, that we're handing out. We're basically KN95s that don't need fit testing. There are also F94s out there that are also very comfortable that don't need fit testing. And so this mask is usually will fit people very well. You want to make sure you get the right size. I have a size small. So you want to make sure that it fits well, that you make sure that it's pinched against your nose, and that there's no opening around the mask and around your mouth and around your chin. So we know that N95s, KN95s are a hot commodity right now, and not everybody can get them. And that's okay, because there is another alternative that is great. Because today I brought my Plan B. So my Plan B, which is actually very comfortable, is double masking. And we talked about this earlier in the pandemic. So with double masking, you would use a medical mask, so a disposable mask, and also a cloth mask on top of it. So the medical mask is high quality, has good air filtration, so you can put that over, make sure you have a good seal around your nose. But you can see here that it always bunches up around the side of your face, so it's hard to get a good seal. So then on top of it, I'll put my cloth mask, and this is like a 2 or 3 ply cloth mask. You want a thick cloth mask, and I put some adjustments on the earpieces to make sure that I have a tight fit on my face. So I put that over my procedure mask, and now you can see that everything is pushed right against my face. There's no gaps, and I am fully protected. So these are both great options for using a mask and protecting yourself against COVID-19 transmission. So these are both good options. Remember, the best mask is the mask that fits you well and that you can wear for a prolonged period of time. Because if you have one of these fancy, say, N95 masks that's really uncomfortable to wear, you're not going to wear it and it's not going to protect you. And then one other thing with these KN95 masks, they're not a one and done. You can use them over and over again. Just make sure that they're not damaged and they're not wet, and then you can keep using them. So, we have to recycle, keep the planet green and keep our KN95 masks going. So just want to talk about another favorite subject of mine with the pandemic is the test to stay. So yesterday we finished off putting together a protocol, a policy that we are going to share with all the schools tomorrow. And I want to thank some superintendents that gave us some great input into developing this policy. So I just want to emphasize that we did get input from a couple of community superintendents that represent different areas of the county, and so they really helped us make this a great policy. So tomorrow we're going to have a WEDEX with all the schools and all the school superintendents and school principals, private, parochial, charter, public schools, and explain to everybody what they need to know to start Test to Stay. So we're going to talk about our goals are to keep kids in school. We all have the same goals, and we all hopefully will get the same way to get there. We're going to talk about the participation requirements in the program, and then we're going to talk about how the schools can order test kits from us and how they can collect them, and so they can start their way on their Test to Stay program. So we based this protocol basically on the New York State Health Department Test to Stay guidance and our lessons learned from our Grand Island pilot experience, and again from input from a couple of superintendents that were really helpful in helping us craft this Test to Stay policy. So moving on to vaccination, that is also a very important intervention that we can do ourselves to make sure that we stay healthy through this pandemic. So at the county, we are trying to be very aggressive about making sure that everybody has access to COVID-19 vaccine. So we have our brick and mortar sites, but we also are traveling throughout the county to make sure that people in all different parts of the county have access to free vaccine. So we're offering Pfizer and Moderna for anybody age 5 and up. Throughout the county. On Mondays, we're in Amherst at the Adult Day Services. Tuesdays, we're in the city at the Delvin Grider Community Center. Wednesdays, we're in Orchard Park at Chestnut Ridge. Thursdays, we're at the Elma Meadows Park. And Fridays, we're back in Orchard Park at the Fire Company. Our hours of operation are between 11 a.m. and 7 p.m. We do encourage appointments. If you're going to walk in, best to walk in the last couple hours of the clinic, like sometime between 5 and 7, because we're not as busy and you won't have to wait so long. As I mentioned, we also have some brick and mortar vaccine sites. So we are at ECC South Monday through Fridays, so check our website for the hours of operation. We also are partnering with Buffalo Home Care at their 490 Delaware office in the city of Buffalo and their 5847 Transit Road office in East Amherst, where they are open from 9 a.m. to 8 p.m. So on your way home or after school, you can take your kids to get their vaccines. And then on the weekends, they're open from 9 to 5. Also, we are still offering our Vax visits, so if you choose to get a vaccine in the privacy and comfort of your own home, we are all about that. So all you have to do is call us at 716-858-2929, give us some information, and Buffalo Home Care will contact you to set up a time that is convenient for you to get yourself and anybody else in your household vaccinated. Remember our website, if you want to look at where we are every single day of the week, it's at www.erie.gov/vax, V-A-X. If you want to see where other vaccines are located in the community, you can go to the government's website at vaccines.gov. Many pediatricians and adult healthcare providers, including UBMD, are offering the vaccine in their offices. And then we're also working closely with schools. We have a bunch of vaccine clinics scheduled for the month of January, both in Buffalo and at suburban schools. So check out our website. Also, we're excited that we have more people that can get the COVID-19 boosters soon. So I'm sure you all heard in the news that the FDA recently approved COVID-19 boosters for teenagers between the age of 12 and 15. So now so after the CDC meets about this in the next couple days at their ACIP meeting and provides recommendations about how to give these booster doses, everybody 12 and up will be eligible for a booster dose. So for those kids, that'll be actually what the FDA recommended was 5 months after their second dose of Pfizer. So we'll see what CDC comes up with, but we're really excited that we'll be able to give extra protection to our teenagers to protect against COVID-19 with a booster so they can stay in school. So as the county executive mentioned earlier in the hour, that we are seeing a lot of people who are turning COVID positive in the past couple weeks. So, and we know that because a lot of people are testing. So the demand for testing is hot. We know that a lot of people are interested in getting tested. We know that Omicron has very mild symptoms and can present like the cold. So we want to make sure that that people have access to testing. So we're responding and we are expanding our availability of testing. So starting this weekend, we are going to be offering weekend hours of testing. And then next week, we're going to be extending our hours of operation for the testing, and we're also going to be offering testing in multiple locations. So we want to meet your needs, and we want to make sure that every Erie County resident can get a test if they want if we want to. There's a huge demand out there. We're not going to be able to meet it. There are lots of other testing locations in our community. There's also people can go and to the pharmacy and buy home tests. So the important thing is to know your status. Even just little sniffles can be a COVID-19, and I'm sure everybody by now knows somebody who's tested positive in the past week or two. So it's really important that we know our status, because that's one of the ways we can stop the chain of transmission. So to get a test for Erie County residents, this is free. I know that some testing sites charge a lot of money, but this is free for Erie County residents. So all you have to do is call 716-858-2929, and we can schedule you for an appointment. So our public health lab is offering molecular diagnostic testing with a PCR or polymerase chain reaction. And we're actually not just offering one, but 3 tests in one. So we are testing for COVID-19 and influenza A and B and respiratory syncytial virus. And unfortunately, we already are seeing cases of influenza in our community. So important to get your flu vaccine too. So usually our turnaround time on the PCR tests, which are the most sensitive tests available, are between 1 to 3 days. We call all Erie County residents who have had a positive test from our public health lab, so that you make sure that you know that what your status is. We are also offering rapid tests with our ID Nows that are also molecular diagnostic tests that you can get the results back in 15 minutes. So we are opening this up to any Erie County resident who has COVID-19 symptoms. So not just our K through 12 staff and students, because they have a lot of the rapid antigen tests in the schools. They can test themselves. So we want to open this up to the community so people with symptoms will hopefully know their status with a really good test and know if they have COVID-19. Please call us to make an appointment if you want to know your status. So the question is, what happens if I get a positive test? Because now we know that a couple thousand people a day are getting a positive COVID-19 test, and it's not even including the number of tests that people are turning positive at home. So the question is what to do. Well, first of all, number 1, isolate. Number 2, isolate. Number 3, isolate. Stay away from everybody else. At the Erie County Health Department, we're seeing several thousand COVID-19 cases a day, and we just do not have the capacity to contact everybody. So as I said earlier, we are contacting everybody who we tested at our public health lab. We are doing our best to contact all children, and we are doing our best to contact people who are living in congregate living situations if we find that out. So we are doing our best to prioritize what the highest risk groups are. But many people will never hear from the Erie County Health Department from a phone call. So we've been doing this for almost 2 years. It hasn't changed. You need to isolate. And we have all the information that you need need on our Erie County website at erie.gov/IQ. So that stands for Isolation Quarantine. So you can go on our website, get all the information you need about how to isolate and quarantine. You get information about how long you should isolate or how long you should quarantine, or if you should quarantine at all if you're a close contact. Also, for those people that test positive, it's really important that we're relying on you to notify all your close contacts that they've been exposed. Remember, Omicron is so contagious, so it's really important to stay away from everybody in your house. Make sure those people in your house get a test 5 to 7 days after their last contact. People who are not vaccinated need to stay in quarantine for 10 days and make sure that they're not incubating and could infect somebody else. So all that information is on our website. Again, we're relying on the public to do the right thing, and all the information to do the right thing is on our Erie County website at erie.gov/IQ. So please, if you have a positive test, if it's a lab-based test or a home test, isolate. If you have a home test, you can report it to us. We now have a testing website where people can report their own home tests. We've had about 1,800 reports since we opened it up last week. So people are using this website, and we do appreciate that. It's good to know. We will enter that into the state's database of positive cases. However, we are not going to be calling you. So, please enter that information. We also will push you to our isolation and quarantine website so you can find out how to isolate and then how to notify your close contacts and give them information about how they need to quarantine, if they need to quarantine. But whether they're vaccinated or not, they should get a test 5 to 7 days after their last exposure. Vaccinated, don't need to quarantine. Not fully vaccinated, do need to quarantine. And so even if you do have an at-home test, even though it's not a laboratory-based test, a positive test equals COVID-19 infection. So please isolate. If you have a negative test with one of these home tests, remember, these are not the most sensitive tests out there. There can be false negatives, and this is one snapshot in time. So we recommend that, especially if you have symptoms or if you are a close contact and you have a negative home test, that you go out and seek a laboratory-based test, preferably a PCR test to confirm what your true status is. And so now I'm going to turn it over to the county executive to answer some great questions. So thank you.
Thank you, Dr. Burstein. As we've noted, there's COVID everywhere in our county, our region, our country. The best thing that people can do is to be prepared by getting vaccinated and boosted. We do know that individuals can catch the illness regardless of whether being vaccinated or boosted, though they have either almost no case, they're asymptomatic, or a very, very mild case. We do see a significant portion of the people who are hospitalized being unvaccinated. It's generally around 70% of those that are in the ICU that are unvaccinated or on ventilators. So I think it's exceptionally important now, with so much transmission in our community, that people get out and get vaccinated if they haven't. And I do know, having seen the death reports of individuals in this community who are in the prime of their life who unfortunately died from COVID-19 because they were unvaccinated. With that, we'll open it up to questions. Let me start with Jeff Russo of Channel 7.
Good afternoon, County Executive. Happy New Year.
Happy New Year to you.
If I could switch gears real quick away from COVID, I could take a breath from all of the data coming out today. The governor has their State of the State address tomorrow, and when it comes to the stadium talks for the Buffalo Bills, you had mentioned several weeks ago that your hope was to have a deal in place by the end of December. Can you update us where you believe talks are, and should we expect to hear an update from the governor tomorrow?
I do not expect to hear an update from the governor tomorrow. There have been significant discussions over the last 2 weeks that I will not deny, but we are not imminent to a deal. I will say that. There have been some progress has been made, but we are not at a position where I think a deal is going to be announced anytime in the next few days. I know the governor has the State of the State address tomorrow. A lot of people were assuming the governor's going to announce it there, but I do not see that being the case because we don't have a deal. It's as simple as that.
Are you,
And when we have a deal, we'll together.
are you disappointed in that, County Executive? I'm sorry to interrupt you. I apologize. Just the delay there. Are you disappointed that there's not a deal in place already?
No, I'm not disappointed. I think the idea is we got to get a deal done that's right for all. That benefits the community, that ensures the Buffalo Bills are the Buffalo Bills, but we're not, as I said, there's never going to be a blank check. And the dates are dates. If you remember back, and Jeff, you've been at Channel 7 for some time, when we did the 2013 lease, I actually announced early in my tenure in 2012 that I was hoping that we'd get a deal done by training camp. And of course, that's July. We didn't announce the deal until December, 5 months later. And then we didn't actually close the deal, have official deal until May of 2013. So, I mean, dates are goals, but they're not necessarily the be-all, end-all. The goal is to get a deal done, regardless of whether it was done at any particular date. And as I said, I'm never going to just roll over. There's no blank check on behalf of the county. And these are exceptionally complicated discussions. We're talking about construction of a new football stadium, a long-term lease, and everything that goes along with it. It is not like a lease for your house. So, no, I'm not disappointed. I think what we're doing right now is good work on all sides, and hopefully we will have a deal to announce, but I just don't see it being imminent based on where we are, and I do know where we are in the discussions. Channel 4, Chris Horvatis.
Hi, Mark. I'm interested in learning more about the test to stay protocol that the county has come up with. I know that's being shared tomorrow with the superintendent, but since we won't have a chance to speak with you for another week, what can you or Dr. Burstein tell us about what is in that protocol and where these tests are coming from?
Well, I'm not going to go into all the details associated with the county because I think it's important that the County Department of Health have that conversation with the superintendents and the chief medical officers of these school districts before we talk about it publicly. The tests are the tests that were distributed by New York State. So most of the school districts should have these tests. There's other tests if they need backup that they'll be receiving from New York State, and there's some that we have if need be for school districts. But the tests are the ones that were distributed by New York State directly to school districts. And when it comes to the parameters of the Test to Stay program, that'll be discussed tomorrow by our Department of Health school epidemiological team and with the superintendents and their staff. So I think it's best to have that discussion with them tomorrow.
Now, it's my understanding those tests expire in February, so, I mean, is there going to be an additional tranche of tests that will come to them that they can use after February?
I'm not aware of them expanding in February. I do know that the governor has committed to giving a significant amount of tests for the upcoming remainder of the school year. So I know the tests that we have don't expire in February. I don't know what everyone has, but I'm not worried about the tests that we have. I would think that the Binax now and the card tests that were sent out have longer lifespans than others. So if a school district did receive tests that they think are going to expire, of course, the first thing to do is if it expires in February, it's to use them in January, and they'll get restocked. I know they will get restocked. Ron Plants, Channel 2.
Hi, County Executive. I wanted to take you back to the hospitalization question. And a couple of issues here with Governor Hochul that came out yesterday. But let me start with hospitalization. If you heard her press conference yesterday, she is saying now she wants hospitals to start testing, or not testing, but checking with the patients because of incidental COVID tests that have come up, or incidental COVID patients, shall we say, even accident victims that are tested. And she's starting to question whether or not some of those people should be listed as COVID patients because they weren't brought to the hospital with COVID conditions. Dr. Fauci raised this issue, especially with children last week, as you may be aware. So would that cause you to rethink some of your strategies because hospitalization has been a bit of a driver here? And are we perhaps getting patients that really maybe just adding on as opposed to strictly being COVID patients for the counts?
Well, we know the answer to that question, Erie County. It's approximately 90 to 92% of all COVID-19 patients actually are in hospital for COVID-19. There is a small portion of it, less than 10%, who may be going for a procedure or were in a car accident, had a broken leg, they test them, they find out they're COVID positive. But the vast majority, over 90% of those in the Erie County hospitals, and this is based on data that we've received back from the hospitals themselves, are in the hospital for COVID-19. I don't want people to think that the vast majority or even the majority of those that are in hospital with COVID-19 are there for something else. That is not the case. We know that in Erie County because we've been asking the hospitals for some time. We don't get the data on a daily basis. We actually have to make individualized queries with the hospitals, but based on the most recent information that we had from them, at least at the end of last week, it was over 90%. It was about 92% of the patients that were admitted and having COVID-19 were there because they were sick with COVID-19. They weren't there because they had a heart attack and were just determined afterwards to have been COVID-19 positive, even if they were asymptomatic. So it is something we're aware of. I can't speak for other parts of the country, but I do know here, especially because we have an older population, and we still have a significant portion of our population that's unvaccinated, that there are many, many people in hospitals, 374 as of the last day, they had COVID-19. And if it is over 90%, that means it's probably about 340 to 45 of those are in there for COVID-19. So we do know the answer to that question. We don't get it daily, but the vast, vast majority of people in hospital that are listed with COVID-19 are there because they are sick with a COVID-19 related complication.
Can you clarify one last thing then, to the other question about quarantine? Because again,
Yes.
the governor yesterday said there was some confusion there. She wanted to make sure it was correct, that if we're vaccinated, that if you are COVID positive, it's a 5-day period. I checked your website yesterday, and I'm not seeing any clarification on the vaccination. It just says 10 days.
Well,
can we clarify?
Well, first off, you have to be an essential worker under the state's guidance that was issued on December 24th. Not just anyone, but an essential worker. You have to be vaccinated. You cannot be showing any symptoms. And you then, if you're an essential worker, could wearing a mask at work. You're required to wear a mask and you're required to isolate outside of work. The guidance is on New York State. We are expecting further guidance from New York State in the next couple of days with regards to this. We follow New York State's guidance. And as of right now, if you are not an essential worker, if you are not asymptomatic, if you have symptoms, you've got to quarantine for the full 10-day period. But the biggest one is if you're unvaccinated, you must quarantine for the full 10-day period, which means if you're an employer, you get sick, your employer can ask to see your proof that you are vaccinated so that you can return after day 5. And if you refuse to provide the evidence that you are in fact vaccinated, the employer can say, no, you have to stay home and you have to quarantine for another 5 days. So there's a lot more to it than has been described. And as I said, we are expecting some further guidance from New York State in the next couple of days with regards to a number of matters. But the guidance was issued on December 24th. And as a result, there's a good portion of our population that still have to quarantine for 10 days. And we think that's important, that people don't automatically assume, and I think it's important that the media understands that too, that the qualifiers are such that a good portion of our population do not qualify for return to work after 5 days because 1, they may be unvaccinated, 2, they may not be an essential worker, 3, they may still have symptoms, and so it is very complicated. I will not deny that, but we are also waiting for additional guidance that we're expecting from New York State in the next couple of days, and we'll update based on that new guidance.
Restaurant workers? Restaurant workers?
I would, Ron, you had your couple questions. I got to move on, but I would suggest that you go through the New York State guidance, which is available online. It was issued on December 24th. If you just repeat that information there, that's what's in effect in Erie County as well as all the other counties in New York State. Brianne Rogier of Spectrum News.
Hi, thank you. So this question is probably best for Dr. Burstein, but I know personally people who are taking at-home tests and they're getting negatives repeatedly. One woman says that she swabbed her throat and got the positive test at home, and then she went to get a PCR test and was in fact positive. So I wanted to know, is swabbing your throat an option if you feel like you really have COVID but you're getting these negative test results? And also, to what extent do we feel that these false negatives are contributing to the rapid spread right now?
Well, I'll answer the one portion. You should never do something different than what the instructions of the test say. You should never, if it says swab your nose, swab your nose. Don't swab another portion of your body. And we do believe that there are false negatives associated with the COVID at-home tests. We think for those that are asymptomatic, it may be 3 out of every 4 are accurately identified, but 25% might not. And that's why it's not surprising to hear someone say they took a COVID at-home test and they were negative, but then they went and got a PCR test and positive, because the PCR test is the gold standard. I'll turn the rest over to Dr. Burstein, but I would always say to anyone, never do anything other than what's stated on the instructions of a test.
Thank you. So I want to emphasize what the county executive said. So yeah, it should always follow the directions of these tests. These tests have been scrutinized by the FDA, and the companies have presented data about how they perform if by the instructions that are listed in the test. So if you swab a different part of your body than the instructions, we don't know how that test will perform. You'll be doing an experiment on yourself. So you really have to follow the instructions that were approved by the FDA. And as the county executive said, I completely agree that we know that there are plenty of false negatives with these at-home rapid tests. They're antigen tests. They're not looking for DNA or RNA. They're looking for proteins, and you need a much higher level of virus to be able to be picked up by these home tests. Another problem is that people may not be using the home tests properly, like swabbing the throat instead of swabbing the nose as it's instructed. So we can't really control with about how if people are using the test properly, if there's the correct environment, if the tests were stored properly, and if it was too hot or too cold. So there is a risk of false results using an at-home test. However, it is a tool that we have, and it does give people another opportunity to know their status. But again, if it's negative, and especially if you are if you have risk factors that could make you sick, like you're not immunized, or if you are a close contact, you were exposed, or if you have COVID-19 like symptoms, even mild symptoms because you're vaccinated and you're not going to get that sick, you really need to, and you have a negative home rapid test, you really need to go to a laboratory-based test, and especially a PCR or an ID now, and there are other molecular diagnostic tests out there, and to know your status, especially if you're around people that are very vulnerable that can get really sick, like our seniors or people that are immunocompromised or children under the age of 5 that can't get vaccinated. You don't want to be infected with COVID-19 and not have, even though you don't have significant illness, so you yourself don't feel that sick, you can still transmit the virus to somebody else who could become very, very sick and end up winding up being one of those statistics that are in the hospital. So it's really important to know the limitations of the test that you use and interpret that appropriately. Thank you.
Thank you.
Thank you. Emily Gersh from Fox 29. Can you talk a little louder?
Okay, yeah. Is that better?
A little better. Go ahead.
This question is probably better for Dr. Burstein also. So for students who test positive, she referred us to the Erie County Health Department website, which advises isolating guidance to isolating for 5 days. So, for parents and students and maybe even schools who are confused about the time needed to isolate, can you clarify if it's going to be updated or what's going to go on with this?
Well, as we said earlier, the CDC's issuance was then followed up by New York State, and it's 5 days if it is a essential worker who's vaccinated and is not showing symptoms. So that is the standard that is followed in New York State. New York State Health Department, New York State Education Department sets the standard for that, not actually the counties. And it's my understanding it is still 10 days for essential workers, 5 days for essential workers who are vaccinated or don't have symptoms. Everyone else, and I guess a student wouldn't be considered an essential worker, would be on the 10-day protocol. Though, of course, if they're vaccinated and they are just been exposed, they can go to school. But if they're actual positive, they have to quarantine and isolate for the 10-day period. And Dr. Burstein's giving me the correct head nod. Okay, thank you. Sandra Tan, Buffalo News.
Hi, thank you. A couple of questions. One, in regard to Test This Day, I know that you are waiting to talk with school officials tomorrow, but at the very least, in light of the fact that you've introduced this, could you tell us, are all schools and school districts going to be eligible to participate in the Test This Day program if they wish, and how soon could that begin? Separately, in regard to the health commissioner's overtime, when the county comptroller originally put out their report, we did reach out to your office and to the budget office to get clarification regarding the discrepancies between the comptroller's report and what else we've been hearing from your office. We were trying to resolve that issue, and we received no response. So we would like to follow up with folks in your finance department regarding this discrepancy. And I also didn't know if you had any comments or thoughts in regard to folks. I believe Grand Island was the latest requesting that this overtime pay be returned to taxpayers.
First off, I'm not going to talk about what the towns do. They have no say in the matter. Like, we don't tell them how to collect their garbage. They shouldn't be here questioning issues associated with the county. On the overtime, as we said, it's actually a very, very complicated process. We do believe the comptroller improperly included fringe benefit amounts attributable to the doctor in the report that he issued. We don't know for certain because he was wildly off. He was off by, appears, the number that the doctor received over 2 years and what he originally described by some $90,000. But we think he actually may have included the fringe benefit amount that the doctor receives as overtime that was paid, which of course you don't get paid overtime. It's a fringe benefit for your health insurance or the pension payment. I can state, and we'll go in this detail, it's really complicated, but $46,381,084.34 was paid in overtime to all county employees over the last 2 years. $21,154,966.02 in 2020. Wait for Karen to catch up. $25,227,118.32 in 21. That is through the final pay period, which was, I believe, December 24th. A lot of people have been, and I shouldn't say a lot of people, one person has been critical, but he doesn't talk about all the other overtime that's accrued by Erie County employees. In fact, the top 15 employees for overtime accrued over the last 2 years was $2.5 million approximately was accrued. One of them was Dr. Burstein. The other 14 members were members of the sheriff's office. This was a political hit job. It's as simple as that. And we'll be glad to share all the data now that we have it. It's actually 4 different spreadsheets looking at how the overtime is paid out because of how it's allocated in our finance system. But the highest paid employee over the last 2 years received $312,283.25 in overtime, and that was not Dr. Burstein. It was actually significantly more than Dr. Burstein's. Dr. Burstein earned most of her overtime in the first 3 to 4 months of the pandemic when we were in a complete shutdown. And she was here every day like I was here every day, working 14, 15, 16 hours, coordinating with the hospitals, coordinating with everyone. So I got hot last week because I knew the information that the comptroller provided was wrong. And it was being taken as if it was the truth, and it's not the truth. We have the information. We'll share you the full data, Sandra. You can take a look at it. It is not something that someone can just immediately respond to because it is very complicated. I think there's over 2,500 lines in each one of the reports for every employee based on their pay periods. But it's quite clear that I want people to understand that Erie County has always paid overtime to its employees except its elected officials during these situations. And it's just one person is being attacked, and I believe she was attacked for political purposes by the comptroller. To make me look bad, to make her look bad, but even people who made more money than her weren't mentioned at all by the comptroller because he didn't want to do that. Because, of course, he wasn't going to criticize someone else, but he was going to criticize her. So I think everyone needs to understand that what was issued by him, you got to take with a grain of salt. And maybe a grain of salt is even too much because it wasn't accurate, it was wrong. And we'll give you the accurate information. It's a lot. But $46,381,084.34 was the full amount. I'll turn it over to Dr. Burstein to answer the rest of the question regarding, I think it was test to stay.
So as the county executive mentioned, we're going to be releasing more specific details about our test to stay policy tomorrow when we share that with the superintendents. But I have to say that we hope that every school will be able to meet the criteria, the eligibility criteria to participate in test to stay. We want schools to participate. We want to make sure that they do it right. We want to make sure that they have a good, solid plan for testing and that they have what they need just in terms of training and licensure and staffing to be in place to be able to do this test to stay program properly, so we get good results and that students who are sick are identified and students that are not sick are able to stay in school. So I hope that every school will be able to meet the criteria to be eligible. There are criteria, although they are not difficult, and I think any school can become eligible. It's not difficult to, for our criteria are not going to be difficult to achieve. So we're hoping that every school will be able to participate in test to stay. That is our goal. Thanks.
And can you say how soon maybe it could work?
How soon? Sorry.
How soon people can participate in this program?
Well, we are going to announce what the criteria are and the policy is tomorrow with the schools. And they have to put together a plan. And as soon as they have a plan in place, they can let us know, and they can collect the tests, and they can start testing. They can start the program. So it's the ball will be in their court after tomorrow.
Okay, Michael Mroziak, WBFO.
Good afternoon, County Executive. I have an on-topic and an off-topic, if you can indulge me. The on-topic is this. Health officials were, of course, anticipating a rise in COVID numbers coming out of the holidays. People would gather for Christmas, gather for New Year's. Is there still an ability to project when post-holiday infections might peak, or is the ability of Omicron to spread as fast as it does kind of muddy that ability?
It has muddied it. We were getting some pretty good data and projections from the University of Buffalo, but Omicron has totally thrown that out the window. We have heard from our contacts with the state as well as federal contacts that it could be 2 weeks, it could be 4 weeks. We really don't know. As we said, we've seen so many of our Erie County residents test positive, just like any other counties have tested positive with Omicron. So it would be just a guess at this point. But yes, the projections we had beforehand were pretty accurate, but they were totally tossed off to the side with Omicron when these numbers just shot through the roof. And then you had one other question?
Yes, my off-topic was this, regarding the state of the state. You already did address the stadium, but is there anything else that the governor might address tomorrow of local interest that you're hoping she addresses in her state of the state?
Well, I've talked to the governor a lot lately, and I'll leave it up to the governor to announce what she's going to announce in her state of the state. Just leave at that. Final question goes to Braden Wilson from WBEN.
Hi, County Executive. Thank you for taking the question. There are some medical experts that have been downplaying the significance of delivering the case numbers with COVID-19, and the focus that they've brought up should be solely on hospitalization numbers regarding COVID-19. Have you, the county, or anyone else that you've talked to, and I'm just curious about this, have you guys given any thought of just excluding case numbers with COVID-19 and the stats from your briefings, or do you feel that it's still of importance to give out that kind of information?
Oh, we find it to be very important to get that information, especially when we see locational outbreaks. We need to know that information. We are going to continue to share it. We have said for some time hospitalizations are key as to whether or not we move into a phase 2 or a phase 3. Hospitals are going down. Hospitalizations are going down. They have gone back up. They have not shot through the roof where the hospitals are basically full, so we're happy about that. Hospitalizations are still going to be key. We are seeing, as we noted, even with the hospitalization increase, we haven't seen a big increase or hardly any increase in the ICU usage. That's really important because that tells you how the severity of the illness is based on whether someone is hospitalized for a day or two or they're there for a week or two because they are in the ICU unit on a ventilator. So the hospitalizations are still key, but we believe it's important to get an accurate information out to the public, which is of the people who are testing, here's how many are testing positive. And I think it's important for people to see that because it's all over the country. It's not just here. I don't know why anybody would want to fly right now. First off, you don't know if your flight's going to take off because are they going to have a flight crew? But you're going to be going to other parts of the country where the numbers are even worse. Florida's horrible right now. I have friends in Texas are telling me it's horrible right now. It's just bad everywhere. So I would just tell people to take precautions. Be fully vaccinated, get a booster if it's been a certain time since you got your full vaccination, and wear a mask to protect yourself. Because you may catch it and you may not have a serious illness or any illness, but you could pass it on to someone else who may be immunocompromised standing right next to you at the supermarket who can't get vaccinated. And if they catch it, it's a death sentence for them. So we need everyone to work together, be our brothers and sisters keeper. This is where the good of America comes forward, when we come together to rally around each other. And I think that's what we've seen from the vast majority of the public is they understand that we need to work with each other to protect each other. Because even if you catch it and you don't get a serious illness, you could pass it on to someone who could die from it. And unfortunately, looking at the numbers that we're seeing, there are still people dying in our hospitals every day. And I know recently we had 1 or 2 deaths in nursing homes. People who caught COVID today or yesterday, there are some of those who are probably going to die. And so it's important that we do our best to keep that number down because it's not just about the cases, it's about reducing our hospitalizations, which means reducing the number of people who are getting sick, because when you reduce hospitalizations, you inevitably reduce the number of people who die from it. With that, that's a final question. Thank you all. If you have any additional information you're interested in, you can contact the public information officers from my office or the health department. I want to thank Karen Gambino for providing our American Sign Language today. Thank you all at home for participating in today's press briefing. If always we have something urgent to announce, we'll have another briefing. Otherwise, we expect we'll have the next briefing on Tuesday, January 11th. Take care, be safe and well to all.